Welcome back, everyone. We hope you enjoyed the sessions. We had 130 submissions during our call for presentations this past fall, and the selection process was very difficult, but the speakers we selected have been phenomenal so far, and I'm so grateful to them. We have a jam-packed afternoon coming up with some great insights, so keep your energy up. Take the conference on the road and go for a walk while you listen, or stand up, do some yoga, do some jumping jacks. Get your notepad out, take notes, because you are not going to want to miss these insights. First up this afternoon, we have Dustin D Tommaso. Dustin is head of MadPow's behavior change design practice, and he will be shedding light on how we can best measure the experiences, interventions, and digital health products that we're designing such that we achieve the best outcomes. Dustin is a fantastic human being, and I'm so excited to welcome him to the stage. Here's Dustin.
Thanks so much, Amy. It's great to be here. Yeah, let's get to it. We are all here because we have an interest in improving health and healthcare. And we believe that there's a tremendous potential in digital health to make people's lives better and improve the health, well-being, and quality of life for our end users. We all want the products and services that we design and deploy to be successful, to be effective in improving outcomes. And when we think about it, when we look across the horizon, when we look to where many of our products and services are deployed, or at least where many people are picking up products and services, we think about apps and app stores. There's more than 400,000 apps available in the app stores. 400,000 and growing every week. But out of those apps, out of the ones that are intended to treat an illness or symptoms or manage chronic condition or increase the uptake and sustainment of health prevention behaviors, how many are able to say with a marked degree of certainty that they can deliver on their promise? By some accounts, this number is around 2%. 2% of our collective work aimed at improving mental, physical health can point to any at all scientific evidence that the solution works. That being said, how many do you think make claims that their products and services work? More than 2%, right? For sure. In the digital mental health space, a study on the use of evidence found that about 64% of the apps that they coded in that study claimed effectiveness at diagnosing mental health conditions, improving symptoms, mood, self-management, right? But about only 3% could back that up with evidence. And so I've got an app to sell you if those terms sound really good for you. But I think, you know, the perspective here is that for all of us, no matter if we're working on clinical apps, even health and well-being apps, it's not entertainment. So therefore, we're probably looking to make an impact to affect outcomes in one way or another, right? And to do that, we really do need to get diligent about turning this around, right? If those numbers that I mentioned aren't enough to move you into action, right? Let's look at a few other reasons, right? Beyond what I led in with for why we should be evaluating and integrating evaluations throughout our design process, and a couple things we can do really quickly to get started. So if we go back to that number, that 400,000 health apps, how do we decide which ones to use, right? Well, we can consider the cost, we can consider the aesthetics, we consider reviews or personal recommendations, data privacy, security, especially when we think about the new Apple Health rating systems. We could think about quality of evidence as being a marker on apps too, but beyond that, we also think about whether or not we think the app is going to work, right? And perhaps even how much we think we might have to work in making those outcomes occur. So these factors, right, might be weighted a bit differently between individuals or even within a person, depending on the context. Sorry. And here's the thing, though. When we think about what's at the center of all of this, people are downloading and using health apps to improve something in some way, right? Maybe they want to meet a personal goal. They want to ward off the negative effects or symptoms of a health condition. They want to retain health. They want to feel better. They want to make the day-to-day work of managing a chronic condition cognitively, emotionally, and physically easier, right? That is our promise. When we go to market with a health app, whether or not we make explicit claims of what we can achieve or what an individual can hope to achieve by using our products and services. The slickness of our apps, the usability, the quality of experience absolutely matters. But our ability to deliver on our promise to deliver outcomes is what matters most. So I like to say that effectiveness is the most important differentiator between digital health offerings. And the only way we know if we're producing those effects is by running evaluations and making evaluation an integral part of the design process. If we look across the evidence-based technology movement, right, digital medicine, digital therapeutics, we can see a growing alliance of individuals, of organizations, all committed to ensuring that digital health technologies are safe, they're effective, they're evaluating products through phased clinical trials, right? They test repeatedly software that's intended to treat, manage, prevent a broad spectrum of diseases and disorders, right? And that's a pretty darn good value proposition. We have safety, efficacy for individuals. We have effectiveness for payers, for providers. It's hard to argue with that. And I would say that I think as this list of behaviors or outcomes and products grows, right, the conditions that are being treated or covered or going into these DTX trials, I would say that as this expands, and it is expanding rapidly, at some point or another, if your product, your service uses any words close to treat, manage, prevent, at some point we're going to be competing with a digital therapeutic that has shown clinical efficacy and real-world outcomes, right? And another factor that we can look at to keep us being mindful and keep us pushing forward in our ability to achieve outcomes is that when we think about the adoption of standards, frameworks, and regulations that are appearing in Europe, in countries other than the US, right? If we want our apps to be a part of that healthcare system, to be recommended, to be prescribed, to be part of a formulary, then we need to demonstrate efficacy or patient-related improvements like health literacy, treatment adherence. We need to demonstrate safety, it needs to be usable, accessible, interoperable with the health system infrastructure, and hold a high standard for data security and privacy, right? And in the US, we're a little bit behind there, but that we can see a number of frameworks are there. There's just not the same level of mandatory regulation that they have. But maybe it's coming, right? Maybe that is leading the way to what we should be thinking about and setting the groundwork for now. Even if we aren't there yet, we know that when we work with payers, when we work with providers, there's a huge interest in creating these kinds of formularies, right? People want to know, what apps can I recommend? How do we make decisions upon what kinds of applications we can offer to our members, to our patients, so on and so forth. And in the end, this is good for patients, it's good for payers, it's good for providers. Help us all make better informed decisions about what products we can recommend and use. So if we think about that quickly, what could we be doing, right? What is it that we should be doing now? Well, we can start by considering evaluation as an integral de facto part of your design process, right? We can think about evaluating apps all the way through all steps of a design life cycle, right? From the earliest concepting onwards. And those methods are more than RCTs, right? When we talk to people, folks think about I need to do a randomized controlled trial or nothing, right? But there are other kinds of evaluations depending on our question, depending on where we are in the maturity of our products and services, that we can start to integrate if we aren't already. So we can start here. We can start with qualitative evaluations, right? To understand how people experience or feel about a product or service, gather rich data through small samples. You're probably already doing this, right? When we think about acceptability or usability testing, we can think about descriptive evaluations, things like analysis of existing data, right? So we can understand what's going on, how many people are using our service, how often do they use it, how long do they stay engaged, what do they use, right? Engagement, other metrics around usage. This has a value when we think about the connection of engagement to outcomes, the dose response that often we have no idea going into design or going into deployment, but a test that we can figure out to understand what is the right amount of engagement to reach outcomes for most people. So we're not overburdening individuals. We can think about economic evaluations as well. How does our product and pricing cost benefit compare to other options that are in market as well? And then, of course, yeah, we can also think about RCTs, right? If we want to understand whether or not a product is working as intended, we need to be able to compare our product to and populations using our products to populations not using our product to understand for sure if those outcomes are associated with what we've put out in the world versus chance versus picking up some other kind of intervention or versus some other sort of phenomenon, right? We want to be able to tie it back specifically to what we've done. And we can look at this across a life cycle of project maturity, right? I'm using some terms here: concept, pre-prototype, prototype, alpha, beta, live. You may use other terms: pre-market, market, MVP, this sort of thing. But the idea here is we can start early on those acceptability trials. Do people understand the product and service? Does it resonate with them? Do they believe that it's going to work? Is the perceived burden of use too great? From there, when we have something that people can interact with, we can usability test it. Feasibility testing is kind of like testing of tests, right? When we think about actually going into trials or comparator trials where we're going to test outcomes, we want to be able to test our study the same way you would pre-test a survey, right? We want to do that with our study. So we could run a feasibility trial there. Efficacy, again, is does it work? Does it have an effect in a controlled environment? That engagement gets us to the dose response. Process enables us to really dissect what works and the processes that work within our intervention. Economic, you understand, and eventually when we think about these more complex trials, effectiveness, optimization, we can get to those when we have a nice, well-tested, well-iterated, robust application. There's sometimes a jump if people have the funds, if they have the resources to get straight into comparator trials. But it's interesting, right? When we think about it, if your usability isn't squared up, if people don't understand the ins and outs, they can't use the application, you're bound to have no effects or negative effects when you get to larger, more complicated trials, right? So really thinking through those phases of studies, what we're testing and when is beneficial for everybody. So how do we get started? What can we do now, right? Beyond jumping straight into some kind of trial that's unfamiliar with us or partnering with someone to run a trial right away. The thing I think we can all start to do, or you can all start to do, is create a model of your product or service. It's the first step for being able to do any kinds of outcome studies, right? We need to understand how our application works, is intended to work, and what we're striving for at all those connection spots in between, right? We want to rally around the outcomes. What change do we want to see in the world, whether those are clinical, psychological, well-being outcomes, what behaviors are linked to those outcomes, what do people need to do to reach those outcomes, what actions, self-care, self-management do they need to take that our product or service facilitates, what lies under those behaviors, the determinants that make that behavior more or less likely to occur. This is where lots of our formative research comes in to understand these problems. We frame strategies and techniques that we put into our interventions as behavior change techniques: goal setting, instruction on how to do something, action planning, social support. These are the techniques that change those determinants, right? And they roll up into the features, the interactions, the content, the components of the products and services that we design, right? And that can look something like this, right? A little complex, but I tried to keep it as simple as possible. When we think about, again, if we're looking to reduce HIV viral load, we worked with Brown School of Public Health over the summer to work on a motivational interviewing application for changing alcohol use and increasing ART PrEP adherence to lower HIV, right? So when we think about that outcome, right, that's the outcome we're looking to achieve: reduce the viral load, the behaviors that we want people to do. We want them to increase antiretroviral or PrEP adherence. We want them to decrease alcohol use because there's a correlation, there's a relationship between the two. From there, when we think about what lies under those behaviors, no surprise to folks, right? Intentions, right? Do we already have an intention to do one or the other, to either reduce alcohol use or increase PrEP adherence? What comes before those intentions? Beliefs about health, beliefs about my behaviors, other people modeling that behavior in my social environment, getting social support from other people that are my peers or near peers to me. Oh, I got social support twice. Well, it's doubly good. Behavioral skills, the ability to remember to take medication, to bring it with me when I need to go someplace. Same with condom use or other behaviors as part of this intervention. Then we can think about, within that intervention, how are we targeting beliefs, social support, behavioral skills, motivation? What are the components and the content by which we're delivering those behavior change techniques to change those items that need to change for behavior to occur? So we can then tie that back to our motivational interviewing component, the onboarding process that we have that asks people about their values and goals, the peer component part that gives community support, the text messages that get automatically sent or triggered at certain events or time of day, mindfulness meditation to reduce anxiety, stress, emotional consequences, and again, practicing these kinds of behaviors in a safe environment, making plans and contingency plans to carry them out when most needed, right? When not under duress or stress. These are the things that come together. When we want to evaluate, when we want to see if we're having an effect, we need to look at all the pieces throughout that chain. And that enables us to see what's working, what's not working at every step of the way, so that we can make changes, so that we can optimize, so that we can improve our intervention over time and scale. So finally, in my lightning talk, we're rapidly moving towards effectiveness as the key differentiator in digital health. Right? This is the number one differentiator, I think, that we're all being faced with now, that we should get ahead of and start thinking about. Products and services should be evaluated throughout the design process, from the beginning all the way through maturity, for a host of different reasons that I hope I've laid out. There's a number of options that we can take to gather evidence about if, how, and why your product works. Some complex, some much less complex. We can build up to more complex evaluations when the time is right and when you need that evidence. And there's things you can do now, right? Like starting to create that model. If you don't have those skills in-house, you can find partners that can deliver upon those skills to really audit or workshop those kinds of connective tissue throughout your core services. And again, that helps you be much more ready and able to run evaluations, to be effective at running evaluations, and those evaluations should make you more effective in achieving the outcomes that you're here to achieve in the first place. That's what I got for you. So thanks so much. Have a great rest of the conference. Feel free to hit me up with any questions, and I'll see you around the Zoom chats.
Thank you so much, Dustin. That was awesome.